What if there was a disease so rare that it could wipe out entire families, and doctors couldn't even diagnose it for decades? Or a sickness so deadly it could turn a healthy person into a corpse within hours? Stay tuned to discover the deadliest diseases you've probably never heard of. Rabies. Rabies is one of the deadliest diseases known to humanity. It's caused by a virus that attacks the nervous system, leading to severe neurological damage and ultimately death if left untreated. The rabies virus is typically transmitted through bites or scratches from infected animals, most often dogs, bats, or raccoons. Once symptoms appear, there's no cure. Death follows swiftly, often within a few days to weeks. While rabies is almost entirely preventable with early treatment, a series of vaccines, it remains a significant issue in many parts of the world, especially in developing countries where animal vaccinations are not widespread. What makes rabies particularly terrifying is its incubation period. Once bitten, the disease can lie dormant for months or even years, allowing people to unknowingly carry the virus until symptoms start to show. In those final stages, rabies can cause extreme aggression, hallucinations, and hydrophobia, fear of water. Despite its rarity in developed nations, rabies still kills tens of thousands each year, mostly in Asia and Africa, making it a continuing public health threat. Kuru. Kuru is a rare and deadly disease that affects the nervous system. It was discovered among the Fore people of Papua New Guinea, and it's associated with the practice of ritualistic cannibalism. The disease is caused by prions, misfolded proteins that infect the brain and cause it to deteriorate. Kuru's symptoms include trembling, loss of coordination, and difficulty walking. But the most disturbing symptom is the complete loss of the ability to speak or move. The disease was passed on by consuming the brain tissue of deceased relatives, which was a cultural practice among the Fore people. Over time, scientists realized that Kuru was caused by prions, and that the consumption of infected human tissue could lead to the spread of the disease. The epidemic of Kuru virtually disappeared after the Fore people abandoned the practice of cannibalism, but the disease serves as a haunting reminder of how a simple cultural practice can lead to the spread of a deadly illness. Kuru is rare today, but it's a vivid example of how prion diseases like mad cow disease can be passed between humans under certain circumstances. Necrotizing fasciitis. Necrotizing fasciitis, often referred to as flesh-eating bacteria, is a fast-moving and deadly infection that destroys soft tissue, including muscles, skin, and fat. Caused by a variety of bacteria, most commonly group A streptococcus, necrotizing fasciitis can spread at an alarming rate. It enters the body through cuts, surgical wounds, or insect bites, and begins to destroy tissue almost immediately. The disease progresses quickly, often turning fatal within hours if untreated. Infected individuals may experience severe pain, fever, and swelling at the site of infection, and the affected area can rapidly turn black or gangrenous. Prompt surgical intervention, including the removal of dead tissue, is necessary to save the patient's life. But even with treatment, necrotizing fasciitis can be fatal in as many as 25% to 35% of cases. The bacteria responsible can be found in the environment, particularly in places like water and soil, making necrotizing fasciitis a constant threat, especially for individuals with weakened immune systems or those who engage in activities that expose them to potential infections. Hantavirus Pulmonary Syndrome. Hantavirus Pulmonary Syndrome is a severe respiratory disease caused by the hantavirus, which is spread to humans through contact with the urine, droppings, or saliva of infected rodents, particularly deer mice. Infected individuals experience flu-like symptoms such as fever, muscle aches, and headaches, but the condition quickly escalates into severe respiratory distress, making it difficult to breathe. What makes HPS particularly deadly is the rapid progression of the disease. Within just a few days of exposure, the virus can cause fluid to build up in the lungs, leading to acute respiratory failure and death. While it's rare, only a few hundred cases are reported annually in the United States, the disease has a high fatality rate, with around 40% of infected individuals dying from the virus. There is no specific antiviral treatment for HPS, and the only effective way to prevent the disease is by avoiding exposure to rodents and their droppings. Despite its rarity, hantavirus serves as a reminder that diseases can emerge from unexpected sources, and their potential for harm is significant. Marburg virus disease. The Marburg virus is closely related to Ebola, and like its counterpart, it causes hemorrhagic fever, leading to severe internal bleeding, organ failure, and death. It was first identified in 1967, when outbreaks occurred in both Germany and Yugoslavia, though the virus likely originated from fruit bats. The virus is transmitted through contact with bodily fluids, including blood, vomit, and urine of infected individuals. Marburg has an extremely high fatality rate, often killing up to 90% of those infected. Symptoms include fever, vomiting, diarrhea, and bleeding from orifices, and the disease progresses rapidly, leading to shock and death within a week in many cases. While the virus is rare, it has caused several outbreaks in Africa, with the most recent being in Guinea in 2021. There is no specific treatment for Marburg virus, and patients receive supportive care to manage symptoms. The disease is extremely dangerous, not only because of its high fatality rate, but also due to its potential for outbreaks in areas with limited healthcare infrastructure. Smallpox. Smallpox is one of the most devastating diseases in human history, responsible for millions of deaths over centuries. Caused by the variola virus, it spreads through respiratory droplets from an infected person. Smallpox's hallmark symptom is its characteristic rash, which turns into fluid-filled blisters and eventually scabs, leaving deep, permanent scars on the skin. Before its eradication in 1980, smallpox killed approximately 30% of those infected, and survivors often dealt with disfigurement or blindness. The disease spread easily, especially in areas with poor hygiene and crowded living conditions. However, smallpox was the first disease to be completely eradicated thanks to a global vaccination campaign led by the World Health Organization, WHO. The success of the smallpox eradication program serves as a powerful example of what coordinated global efforts can achieve. Though the disease no longer exists in nature, it remains a potential biological weapon and a reminder of the destructive power of infectious diseases. Plague. The bubonic plague, caused by the Yersinia pestis bacteria, is infamous for its role in the Black Death, which wiped out roughly 1/3 of Europe's population in the 14th century. The disease is transmitted to humans through the bite of an infected flea, which lives on rodents like rats. Symptoms include fever, chills, swollen and painful lymph nodes, called buboes, and septicemia. The plague progresses rapidly and can cause death within just a few days without prompt treatment with antibiotics. Historically, plague outbreaks have been devastating, and although antibiotics can now effectively treat the disease, there are still occasional outbreaks in parts of the world, particularly in rural or underdeveloped areas. The bubonic plague remains a chilling reminder of how easily diseases can spread and devastate populations, especially before the advent of modern medicine. Tetanus. Tetanus, also known as lockjaw, is caused by a bacterial toxin that attacks the nervous system. The bacteria Clostridium tetani typically enters the body through breaks in the skin, such as cuts, puncture wounds, or burns. Once inside the body, the toxin spreads to the nervous system, causing muscle stiffness, spasms, and eventually the inability to open the mouth, hence lockjaw. Without treatment, tetanus can lead to paralysis, respiratory failure, and death. Thankfully, tetanus can be prevented through vaccination, and the disease is rare in developed countries where vaccination rates are high. However, tetanus remains a threat in developing regions with poor healthcare systems and low vaccination coverage. The disease serves as a stark reminder of the importance of basic hygiene and preventive healthcare measures. Ebola virus disease. Ebola virus disease, EVD, is a highly contagious and often fatal viral illness caused by the Ebola virus. First identified in 1976, the disease is primarily found in Central and West Africa, where it is transmitted through direct contact with the blood, bodily fluids, or tissues of infected individuals. Ebola is known for its rapid onset of symptoms, including fever, vomiting, diarrhea, and severe hemorrhagic manifestations, such as internal bleeding and organ failure. The mortality rate for Ebola can be as high as 90%, depending on the strain and the healthcare resources available. Despite significant improvements in supportive care and experimental treatments, no specific cure exists, making early detection and isolation of cases crucial for preventing outbreaks. The disease spreads quickly in healthcare settings with inadequate infection control, and large outbreaks have caused widespread panic and suffering in affected regions. Lassa fever. Lassa fever is a viral hemorrhagic fever caused by the Lassa virus, which is transmitted to humans through contact with the urine or feces of infected rodents, particularly the multi-mammat rat. The disease is endemic in parts of West Africa, and while many infected individuals experience mild or no symptoms, others develop severe bleeding, organ failure, and shock. Lassa fever has a high mortality rate, particularly in cases where treatment is delayed or unavailable. Early symptoms include fever, weakness, and headaches, which can quickly progress to more severe complications like bleeding from the eyes and mouth. The disease can be treated with antiviral drugs, but they must be administered early in the infection. Lassa fever is a serious health concern, with occasional outbreaks that require significant public health interventions. Cholera. Cholera is a bacterial infection caused by Vibrio cholerae, which spreads through contaminated water or food. It causes severe diarrhea and dehydration, and in some cases it can lead to death within hours if untreated. Cholera thrives in areas with poor sanitation, and outbreaks are common in regions that lack access to clean drinking water. The disease spreads rapidly in crowded conditions, particularly during natural disasters or in refugee camps where sanitation is limited. Cholera can be prevented through vaccination, but access to clean water and improved hygiene practices remain the most effective means of control. While cholera is rare in developed countries, it continues to be a significant public health threat in many parts of the world, especially in sub-Saharan Africa and South Asia. Yellow fever. Yellow fever is a viral disease transmitted by mosquitoes, and it can cause severe liver damage, jaundice, yellowing of the skin, and bleeding. The disease is found primarily in tropical regions of Africa and South America. Symptoms range from mild flu-like symptoms to more severe manifestations, including organ failure, shock, and death. The mortality rate for severe yellow fever can be as high as 50%, but the disease is preventable through vaccination, which has been highly effective in controlling outbreaks. Despite this, Yellow fever continues to be a significant health risk in areas with poor vaccination coverage and limited access to health care. The disease serves as a reminder of the danger posed by vector-borne diseases and the importance of vaccination campaigns. Influenza. Influenza, or the flu, is a viral infection that affects the respiratory system. While most people recover from the flu within a week or two, it can be deadly for vulnerable populations, including the elderly, young children, and those with compromised immune systems. The flu spreads easily through respiratory droplets and can cause severe symptoms, including fever, cough, and fatigue. The flu can lead to complications like pneumonia, which is responsible for many deaths each year. Seasonal flu outbreaks occur annually, but the flu virus constantly evolves, leading to the development of new strains. Annual vaccination is the most effective means of preventing the flu, but in some cases, antiviral medications can help reduce the severity of symptoms. Despite modern healthcare, the flu continues to claim lives worldwide, particularly during pandemics like the one in 1918, which resulted in millions of deaths globally. Malaria. Malaria is a parasitic infection transmitted by mosquitoes, primarily found in tropical and subtropical regions. The disease is caused by Plasmodium parasites, which are injected into the bloodstream when an infected mosquito bites a person. Malaria causes fever, chills, and flu-like symptoms, and if untreated, it can lead to severe complications like organ failure, anemia, and death. Despite being preventable and treatable, malaria remains a major health threat in regions like sub-Saharan Africa, where access to healthcare and mosquito control methods are limited. The disease kills over 200,000 people each year, with children being particularly vulnerable. Malaria has been the target of extensive control measures, including bed nets, insecticides, and vaccines. But the fight against malaria is ongoing, with new strains of the parasite posing challenges to eradication efforts. Anthrax. Anthrax is a bacterial infection caused by Bacillus anthracis, which can be spread through contact with infected animals or their products, such as wool, hides, or meat. It can also be used as a biological weapon, leading to serious concerns about its potential for use in bioterrorism. Anthrax infection can occur in 3 forms: cutaneous, inhalation, and gastrointestinal. The inhalation form of anthrax is the deadliest, causing severe respiratory distress, shock, and death if not treated promptly. While anthrax is rare, outbreaks can occur in areas where livestock are infected. Fortunately, anthrax can be treated with antibiotics if detected early, and vaccines are available for people at high risk, such as those who work with animals or in laboratories. However, the potential for anthrax to be used in bioterrorism makes it a continuing concern for global security. Typhoid fever. Typhoid fever is a bacterial infection caused by Salmonella typhi, transmitted through contaminated water or food. Symptoms include high fever, weakness, abdominal pain, and a distinctive rash. If untreated, typhoid fever can lead to severe complications, such as intestinal perforation or bleeding, which can be fatal. Though typhoid fever is largely preventable through vaccination and improvements in sanitation and hygiene, it remains a major public health concern in developing countries where clean water is scarce. Antibiotics are effective in treating the disease, but the rise of antibiotic-resistant strains of Salmonella typhi has complicated treatment efforts. Typhoid fever highlights the importance of access to clean water and healthcare infrastructure in preventing the spread of infectious diseases. If you found this video informative, Consider subscribe to our YouTube channel for more engaging videos like this.